feeding may result in fewer, harder stools. Constipation can make your child feel full and uncomfortable, and it can cause a loss of appetite. To help prevent constipation, ask your child to use the bathroom as soon as he or she feels the need to go. Encourage your child to exercise and be as active as possible, if able. Monitor the number and frequency of your child's bowel movements. If your child has a problem with constipation, talk to your child's healthcare professional to see whether you are giving enough fluids, need a formula with fiber, or need a change in medications. Diarrhea can be caused by medications, nutrients that do not get absorbed well in the intestines, feeding formula too fast, formula that is not mixed correctly, spoiled or contaminated formula, contaminated tube feeding equipment. To manage diarrhea, your child's healthcare professional might suggest changing medications, feeding formula more slowly, replacing the formula with water or an electrolyte solution for a short time, changing to a formula with fiber or to a different formula, reviewing the formula preparation, reviewing the care of tube feeding equipment. Dehydration means that the body needs more water. It can be caused by diarrhea, vomiting, fever, certain medications, or simply not getting enough water. Some signs of dehydration are increased thirst, dry lips, dry and warm skin, rapid weight loss, weakness, fever, small amounts of dark, strong-smelling urine. To prevent dehydration, take extra water between or after feedings as prescribed by your child's healthcare professional. Ask your child's healthcare professional whether your child's medications can cause dehydration. Call your child's healthcare professional if your child has a fever or diarrhea. Ask if your child should take more water or change the feeding schedule or formula. If fever or diarrhea continues, call your child's healthcare professional. If your child's feeding tube gets clogged or blocked, attempt flushing with 20 to 30 milliliters of warm water to unclog. Confirm the amount with your child's healthcare professional. If you still cannot clear the clog, call your child's healthcare professional. The feeding tube will have to be replaced if it cannot be unclogged. If your child's feeding tube is partially out of place, do not use the feeding tube. Tape your child's feeding tube to their skin to prevent further movement. Call your child's healthcare professional and get help as soon as possible. If your child's feeding tube comes out completely, stop the feeding and go to the hospital emergency room to get it replaced right away. Remember to take the feeding tube with you. It is very important to get G or J tubes replaced before the stoma starts to close. Do not try to replace the tube yourself unless you have been taught how by your child's healthcare professional. Aspiration occurs when you spit up formula, and it drains into the lungs and can cause serious problems. To avoid aspiration, elevate your child's upper body at least 30 degrees during feeding and for at least 1 hour after feeding. Some children are sensitive to extra fluid volume. Talk with your child's healthcare professional to decide how much water is used to flush the tube. You may need to adjust from the recommendations that are typically made. Kids like to play. When they are active, make sure that tubes don't get in their way, or that activity doesn't cause the tubes to get tangled or clogged. Here's a couple tips. Put a piece of tape on the end of the tube and run it on the inside or outside of the shirt. Then use a diaper pin to hold it in place. If your child is wearing onesies, cut a little hole in the fabric. Run the tube around his back and pin to their onesies. Then put a shirt over him so he couldn't get caught up in it. Be creative and come up with ways to make sure tubing doesn't get in the way of your active children.